Hi, my name is Jo Gray. I'm based in the UK, and I have a genetic neuroendocrine tumor condition called multiple endocrine neoplasia type 2A or MEN2A. And I was the first person in my family to be diagnosed. But the route to diagnosis was quite a long and rather painful one, and took a total of about 4 years. My first main symptoms occurred after the birth of my daughter, who was born in 1996. And I had lots of headaches, palpitations. I felt very weak, and the headaches were, I described them to my GP as migraine attacks because they were very sudden and they were very, very severe. And every time my GP took my blood pressure or anything or looked at me, I seemed to be fine. And I was kind of up and down for quite a few weeks. And then things started to settle again. And the same sort of thing happened again just before my son was born in 1999. And he came a month early because I started suffering these attacks again, as I called them. They didn't have the headache with them at that point, but they still had the palpitations, the breathlessness. I felt very weak. I couldn't lift my baby up. I couldn't really care for my young child. Um, and I kept going back to my family doctor again. They did some blood tests, and they said, no, we can't see anything wrong. I had some tests on my heart, and I was told that I should stay away from doctors for a while because obviously I was becoming anxious with all this medicalization. So again, these attacks, after the birth, these attacks sort of dissipated again after a few weeks. And I tried to carry on as normal, although I never felt right. I was always very fatigued. And by the time my son was 9 months old, I suddenly became very ill again. I had more of these migraine attacks, but they were much worse now. And they included vomiting. I couldn't eat. I always felt hot. I couldn't take hot showers. There were just so many symptoms all together that it was very hard to pull any one sort of symptom out beyond the headache. So, again, going back to my family doctor, who recognized that I was a mum of a 7 month old, a 9 month old baby boy, and also my 3-year-old daughter. So he diagnosed me as being postnatally depressed, which I disagreed with quite vehemently. And but in the end, I was so ill that I couldn't argue with anyone anymore. And in fact, I decided that life was no longer worth living and that it was probably better if I wasn't there anymore. And at that point, I was taken to a private psychiatric hospital near my home, and I'd been on so many different drugs, sleeping drugs, blood pressure drugs, or I mean, all kinds of different weird drugs that were making me even worse. And when I stepped into this psychiatric hospital, I didn't really care anymore. It was as though, my life was really ended, so it didn't really matter what happened to me. So when I got there, I was taken off all the drugs that I'd been put on by my family doctor, and my head started to clear a little bit, although not completely. I spent a month at the psychiatric hospital altogether, and during that time, my blood pressure was taken every time I had a migraine attack, which again was reasonably regular now. There was no reprieve from it at all. And they noticed that my blood pressure was extremely high every time I had one of these migraine attacks, and I was still weak, fatigued, couldn't eat much, etc. There was a doctor, a consultant clinician who came in, and he gave me a couple of large plastic bottles and said, "I want you to collect your urine in those," which I thought was strange, but I thought, I've got nothing else to do. So I did that. They sent it away, and then he came back to me a few days later, and he said, "I've been looking for this tumor in psychiatric patients for years, 20 years, and you're the first one that I've found. And it's a neuroendocrine tumor called a pheochromocytoma. And it's a functioning, so a secreting tumor of the adrenal gland, the center of the adrenal gland." And at that point, I just felt sort of released from the doom and gloom because I'd had a diagnosis of something tangible. I wasn't mad. I always knew I wasn't that mad anyway. I've always been a little bit mad, but not that mad. And so at that point, I was transferred. I had a scan, and then I was transferred to a large university hospital where I had my surgery. And then, of course, then the floodgates open or the roller coaster starts, and I went for genetic testing, which in those days took about 6 months for the result to come back. And I had some more blood tests, which showed that I had another neuroendocrine cancer called medullary thyroid cancer. So I had more surgery. I had my thyroid removed, and then the genetic test came back saying that I had multiple endocrine neoplasia type 2A. And the genetic testing was then cascaded through my family, and it was actually found that my mother had the same condition, although it had never been picked up, and she'd never had the same symptoms as me. And my son also was found to have the condition as well. So once all the treatments had been, which are mainly surgery, once all the treatments had happened, life settled back down again, and I could actually be the mother that I wanted to be, to care for my children, which was something that was denied me for too long, really, for 4 years. So then life started getting back to normal, and then I noticed some pain in my shoulder, and I was diagnosed with a metastasis from my medullary thyroid cancer in the top of my left humerus. So I had a big shoulder replacement on that side, which took a good 2 years to actually recover from and regain any sort of movement in that shoulder. And then from then on, it's been sort of 6 monthly or annual screening, surveillance, adjusting drugs, and so on. And I've had a good 20 years or so of pretty good health. The hardest thing I think throughout really was not being listened to by my GP, um, who ran just the normal tests and then just made an assumption that because I was a woman who'd had a baby, that it must be psychological. And unfortunately, I think there's still a lot of that around the medical misogyny. So that was one of the most difficult things, and the second most difficult thing was actually watching my son go through surgery at 3.5 years old. Although I understood that the benefit is for him that because his diagnosis came at age 2.5, they will be catching anything earlier, and he will never have to go through the pain that I went through. So one of my messages is that I really encourage doctors in primary care and even secondary care as well. If you've got a returning patient, male, female, whoever, if they're returning time and again, never to assume that it's just anxiety or a psychiatric or emotional problem. And there's a new rule for GPs in England now called Jess's rule, which says that anyone who sort of returns to their GP more than 3 times really needs to have further workup and really try and understand if there is something seriously wrong before it's too late. And this is the only way that we'll catch any of these weird and rare diseases or tumors or cancers, or there's so many things that it could be. So we really need to sort of spread that message far and wide to try and help aid earlier diagnosis of some of these neuroendocrine cancers and any other condition really. So